Welcome to the Healthcare Workers and Integrative Professionals Group. This is more than our 110th. Actually, I think we're 120 meetings and counting. And our theme today is one thing that would make me or you a happier clinician. And we'll continue our theme, which is in order to ask these questions this month and next month on April 13th is our next HCIP group. Our next month's theme is your 10-year dream. We'll start with an exploration and a foundation of rest. Sometimes we haven't had a chance to take a break and to slow down and to refill the tank. It's very hard to ask questions about what would make things better or what do we want in the future. So finding your comfortable position, you may be lying down or you may be sitting in a chair, and taking a few moments to gather yourself and your attention so that you can take probably just about a shorter meditation today, just 3 or 4 minutes, to give yourself a chance to rest and then to drop in a question about what would make you happier, and zeroing in today on one thing as a clinician that would make you happier. Noticing and scanning your body if it helps to lower your gaze or close your eyes. Noticing if you're breathing, if there's tension in your belly, beginning to soften the edges and soften your nervous system just so that you can soothe and calm. Opening and closing the eyes, perhaps looking to the left and looking to the right, feeling like your head can be having micro movements. And once you're settled in your body, giving yourself to take a chance to take a break. And what we'll practice today is just claiming some space. And you can do this again in the evenings or at other times. Just to press play and have a couple of minutes where you are off, disengaging from continuously thinking, listing, accomplishing, responding, taking care of items, managing, and having an internal dialogue in your mind as you go through that. Just taking a moment to come into your body, take a few breaths, just notice. And if you have any training in any meditation technique, and we are recommending consideration of a transcendental meditation technique. I just don't receive any benefit from that recommendation, but just noticing that that is one of the only forms of meditation that helps to empty the accumulated emotions over a lifetime, so that stressors and traumas that can really build up, whether or not they're ancestral or in your working memory, or perhaps just present in your cells and your cellular memory, can be really helpful to have a chance to release and process and let go. So if you do have a meditation technique like that, or perhaps prioritizing learning a skill which helps you to empty out and to release and to process in a healthy, non-suppressive way, taking a few moments of silence, placing a hand on your heart and a hand on your belly, resting. Notice if you're doing anything. And you can walk with thoughts just abiding and allowing any thoughts, sensations, feelings, just being present, but also finding a technique, finding a skillful method to allow, and eventually to allow yourself to empty out without having to respond and do. And this is different from an observational mindfulness. Mindfulness can be returning your focus and returning again and again to the present with an attitude of compassion. And other forms of meditation, for example, transcendental meditation, which does require a formal training program, are a little different. An opportunity to allow, but also not just to be present and to notice, but to return to a non-reactive and non-directive. And what makes other forms of meditation a little bit different from mindfulness is that it's very intentionally an effortless process, taking it as it comes. Taking a few more moments to rest. No matter what the terrain, the thoughts, even if charged thoughts or charged feelings or sensations or intense sensations. Cultivating and learning how to practice effortless, taking it easy. And that completes a brief meditation. If you'd like to extend the time, you can always press pause in the middle of your meditation. And if you have any interest in learning more about specific techniques for meditation, I've been a yoga teacher since 1992 and a yoga therapist in 1993, working one-on-one clients before I went back to medical school or went back to undergrad and then to medical school. And there's so many methods and options. In my experience, the evidence base and the outcomes with transcendental meditation are notable enough to put it at my highest recommendation at this time as a clinician to my patients and to the practitioners who train with me. So taking some deep breaths, coming back to your day or your evening, coming back to yourself, your environment, your reality, bringing a sense of softness and seeing if you can cultivate a sense of effortlessness, effortlessly paying attention, abiding. And if you're interested in learning the specifics of training in a technique, it can take a number of days. It usually does take a number of days to get trained, and then to get checked, and then to periodically practice with a group, with others. And thank you so much for joining today. Just sharing one final image. This workers and integrated professionals group. One thing that make me a happier clinician, a self-care exploration and community discussion. And this meditation is emerging from this framework, which has come out of more than 120 sessions and meetings, listening and learning what is a framework for well-being, boundaries and emotional health, mindset, sense of community. And today we focused on and discussed briefly a formal moment-to-moment practice there's formal practices for meditation, and there's also moment-to-moment choices we can make. So we discussed the formal training for meditation process. Thank you for joining today. Have a great day.